Hi, I'm Julie Brockway. I'm one of the pediatricians at the youth clinic. We're going to talk about baby belly buttons and umbilical cords. They're those kind of yellow, nasty things that none of us want to touch, and we're always worried we're going to hurt our babies if we're messing with those things. Don't worry, you're not going to hurt the baby about. So why do we even have umbilical cords and belly buttons? As you know, that's how we as moms feed our babies through the placenta when they're still inside of us. We get all their nutrients and we help them to kind of clear all the things they need to clear out. But after they're born, we don't need that cord anymore, so it needs to dry up and fall off. When the baby's born, they're going to kind of leave that cord open, let the baby blood drain like it's supposed to, and then the nurse or the doctor is going to put a clamp on it. What that clamp does is gives pressure across that cord so the baby doesn't continue to bleed while that cord is allowed to dry up and those little blood vessels that are there kind of clot. So that's what you'll see when it's in the hospital. The nurse is going to show you how to take care of it, and basically what we do is just leave it alone and let it dry up. The nurse will take off that cord clamp usually when your baby's about 24 hours old and that cord is dry enough. You might end up going home without the cord clamp. You might go home with it. If you go home with the cord clamp, that's not a big deal. We'll just take it off when you come into the office for that first visit in the first couple of days of life. After you get home, it's pretty easy to take care of. There's really nothing you need to do. It's called dry cord care, because that's the safest method and that's what allows the cord to fall off when it's supposed to. So you don't need to wash it, you don't need to put any alcohol on it or hydrogen peroxide. In that process, we also want you to just put loose clothing on the baby, so like a onesie, so the clothing is not catching on it, and just fold the diaper down so that the diaper's not catching on it and that you're not getting pee on it. As it falls off, you're going to find that it kind of loosens from the top and kind of falls off to the side before it falls off. It's going to have like a little string attached to it. Just leave that alone. It's going to finish taking care of itself. Don't pick at it, don't pull at it, don't try and help it. Just leave it be to do what it's supposed to do. It'll be fine. Sometimes when it falls off, it bleeds a little bit. That's really normal. Don't worry about it. You can just clean that up with a dry Q-tip or a soapy water Q-tip and then just dry it again. You're not going to hurt the baby by doing that. If it hasn't gone away in a couple of days, then call us. We'll want you to come in and we'll take a peek at it. Sometimes we have to use a medicine called silver nitrate, which is just a little bit of medicine on a stick to dry that up. Doesn't hurt the babies and it's pretty easy to do, so that can help it to go away a little bit quicker. In summary, I just want to make sure that you're just keeping it dry, keeping a watch on it. You're not going to hurt it. If it gets red, it gets smelly, it gets oozy at all, don't ever hesitate to give us a call about that if you're wondering.